All right, folks, good morning. Welcome to the Newport Chamber's Wake Up Newport program this morning. Another great morning here in Newport Beach. We've got a great speaker this morning. This is just a chain of great speakers that we've had over the last few months, and the topic of fentanyl has been a key thread through a lot of our speakers that have come through here. As a parent, this is very important. So looking forward to our speaker. But before we get to her, let's talk to Steve Rosansky.
Yeah, good morning. Good morning, Wake Up Newport. I'm Steve Rosansky, President and CEO of the Newport Beach Chamber of Commerce, and this is our November meeting. One more to go this year. We're going to have Diane Dixon next month, Assemblywoman. But as Alberto said, we have a great speaker and a great topic today on fentanyl, and I'm sure you're going to learn a lot. And make sure, she said some giveaways back there. Make sure you grab some on your way out, as well as donuts and coffee. So as I traditionally do, I'd like to call out a few of the VIP-type people that are with us this morning. So we have a couple members of the Board of Library Trustees, Paul Watkins back there, the chair, and Dorothy Larson over here. You're the vice chair, right, Dorothy? Vice chair? Okay. Vice chair, yeah. Vice chair. Nancy Scarborough, finance committee member and a declared city council candidate for the 2024 elections. What district are you running for? District 2. That used to be my district. Actually, I'm in 1 now. They kind of redistricted. You know, I was going to run against you, but they put me in 1. No, I'm done with that. I'm the mayor of the business community now. I think that's about it this morning. But like as I said, we got a great program. So why don't we just, Alberto, let's get to it.
So Janice Celeste has an impressive career advocating for her children and families. Her passion for helping needy families began when she worked as an early childhood specialist and parent educator at Children's Hospital of Philadelphia. During this time, she helped families struggling with addiction to ensure their children met their developmental milestones. This early position launched her career as an advocate for children and their families. Throughout her career, Celeste has worked in various fields, including public school teaching, an award-winning author, broadcast communication, as a journalist, and executive positions in the publishing industry. However, her commitment to ending the fentanyl epidemic stands out as a cause she is particularly passionate about championing. With a degree in early childhood education, organizational management, and an MBA, Celeste brings a wealth of knowledge and expertise to all her endeavors. Currently residing in Orange County, she is a valuable asset to the fight against the fentanyl crisis. Help me join me in welcoming Janice Celeste.
Well, thank you. First off, I want you guys to give yourself a hand for being here. First of all, it's early in the morning. Second of all, you want to know about fentanyl because you're here. So give yourself a hand and that person next to you, because that says a lot. I got to remember to do this part. There we go. So a little bit about fentanylsolution.org. Our name is our website. We also go by Fentanyl Solution just to keep it easy. We are located in Newport Beach, right across from Fashion Island. We are one of the only nonprofits fighting fentanyl that actually has a full staff. And all that means is that we have a lot of overhead. Our mission is to advocate, educate, and bring awareness about the fentanyl crisis so that people can protect their own families. Before we get into the economics of fentanyl, though, you need to understand exactly what fentanyl is. Most people have heard of it, have some inkling about it, but they don't know the ins and outs that make this topic pretty scary. And I apologize if I scare you. I know it's after Halloween now, but you're going to need to know these facts to keep your family safe. All right, so let's talk about how it's affecting people in your community. We're going to start with the broad numbers in the United States. It is the number 1 killer of 18 to 45-year-olds. More than cancer, more than car accidents, more than suicide, and more than COVID. Now, you learned how to protect your families from COVID every day on the news, but no one's telling you how to protect your family from this epidemic. It is crazy, absolutely. So in California, we lose about 117 people per week. That is as much as, oops, I got rid of that other slide. Hold on, I went before myself. Okay, so I edited this morning. That's as much as a 737 airplane going down every week. And if that happened, you would hear more about it. Let's go talk about the types of fentanyls. And I'm gonna get through this pretty fast, so if you have questions at the end, please ask. There are different types of fentanyl. Usually what we hear more about are the counterfeit pills. Basically, they look like legit pharmaceuticals. The cartels are really great at pressing them to look exactly like it. A lot of times they can get cross-contaminated through drug dealers, or they can be just fentanyl and filler. Depends on what you get. So that is what you hear most about, and people don't know they're taking fentanyl when they're taking these pills. They think they're taking a Percocet, a Xanax, an Adderall, or something like that. And it doesn't matter what it is. You know, they don't have any motivation really to put medicine in it now. They'll just do filler. Lace drugs, which is usually a powder, you can't see it because it takes such a little amount that is lethal. And so a lot of drugs like cocaine, heroin, not as much now, but you know, they can have fentanyl in them as well. And we have cards on the back, which we call face cards, of people who actually have succumbed to this. Then you have legitimate fentanyl, which is used for pain in the hospitals. Usually it comes in a gel patch that you can wear on your arm, or it can be an injection, and that has legitimate causes that we need to use it for, like cancer. Whenever someone's in a lot of pain, you use legitimate fentanyl. So we want to keep that for the doctors and keep that around. But what I'm talking about is illicit fentanyl. And this is a lethal amount of illicit fentanyl. It doesn't take much. And if you don't have a tolerance built up to this, meaning you're not addicted to it and you didn't build a tolerance over time, this will take you out pretty quickly. It's highly addictive. It's 50 times stronger than heroin and 100 times more stronger than morphine. And we have even stronger drugs out there called carfentanil, which will blow these numbers away. All right, and it's deadly. The new numbers coming out of the DEA recently, as of October 3rd, I believe, 7 out of 10 pills are fake on the black market. Now, can you tell the difference between a fake pill and a real pill? The DEA can't either unless they test it. So the blue pills, oxy, right, oxycodone, and the top pills are fake. The orange pills, Percocets, the top pills are fake. Xanax, the yellow pill, is fake. If you don't know what it looks like in your teen ordering this on the internet, which they do, you don't know when you get it in your hand what it's supposed to look like. Okay, let's go on down. Addiction that we deal with is very small amount of people that succumb to fentanyl that are addicted to it. They pretty much have a short lifespan because they're addicted to fentanyl. They have been Narcan several times. But accidental poisonings happen the most. We think 75% of the population, according to the statistics, are not knowing they're getting it, that they're getting fentanyl without their consent. So they look like everyone in here. It does not discriminate. Every bracket of economics, from the highest, most affluent families to the homeless are being affected by this. And it's called an accidental poisoning when it happens. It's not an overdose. They got it without their consent. They didn't know. It's just like going into a bar and someone putting something in your drink and you die. You don't know that's happening. So poisoning versus overdose. You can take a part of a pill. You don't even have to take the whole thing. It depends on where the fentanyl is in the pill. And you can die. We know a 15-year-old where that happened when he took a Xanax. He only took the corner, and he went up to his room, and he died, and his parents found him the next morning. Usually an overdose looks like this. This is what we're used to, right? A bunch of pills in your hand. Let's talk about what they look like. Senior citizens, women, teens, babies. The numbers for senior citizens and babies have quadrupled over the past few years. Let's go on. It doesn't discriminate for its economics, gender, or race. And let's talk a little bit about Newport Beach. I'll get to my next page. Okay, remember this slide here? It's 117 people per week up in California. Newport isn't, the numbers aren't as bad, but the rates are high. So we're not safe. Just take a look at some of these headlines. And I have to give kudos to the police department and the fire departments because they have been doing an excellent job with this. But let's look at this. Some of these might be a little older than others. I think this one's a little older, but he just got sentenced and looked, he only got sentenced 18 months, right? Killed someone. This is amazing. Look at all this money. I wish they could give it to nonprofits that work in this space. that would be very, can we suggest that to the city council, please? That would be very helpful to keep us around. Now, this is what we found, and these stats are from the OC Healthcare Agency, that the coastal zip codes have some of the highest rates of mortality, emergency room visits, and hospitalizations. And this is for this period of time. Some of the numbers are behind, so we're doing our best to get as much data as we can pulled in, but it's very difficult because we need to also separate data from alcoholism and drugs and what type of drugs. So if you noticed on here, this will give you an idea of some emergency room visits. And we're thinking of Newport Beach as an affluent area, right? So, but if you look at it compared to Laguna Beach and we can't go by Huntington Beach, but Dana Point, those shoreline areas, you can see that Newport Beach numbers are in the triple digits. And this gives you an idea. This is opioid overdose mortality rates by zip code, and you can see right here a close-up of Newport Beach. And you can see we're in some of the darker areas of this map per 100,000 people. So our rates are very high for this area. And this is a newer map. So, and it's been pretty consistent over the years. So let's talk about this. Over time, fentanyl has grown to be the most common opioid among opioid overdose deaths. In 2017, it was only 19.5% of opioid deaths. In 2021, it was 86.8% of opioid deaths. We're in 2023. This drug is growing exponentially for killing people of all ages. Okay, let's talk about the economic impacts. This is scary, right? But remember in the beginning of COVID, this was said that everyone will know someone who has died from COVID. And unfortunately, I can't go into any meeting anywhere. It doesn't matter if it has to do with fentanyl, usually not. It's usually a business meeting like today. And several people will come up to me and say they either know someone who has succumbed to fentanyl or they themselves have lost people to fentanyl. Now let's talk about the impact to your businesses, because this is important. We are losing generations of people, especially in the 18 to 45 year range, because that's our workers, and that's why it should be important to everyone in this room. Accidental poisonings will result in unexpected and sudden loss of experienced and skilled workers, causing disruption in operation, loss of institutional knowledge, and the need for replacements. So your employees are dealing with this whether you know it or not, but they're dealing with it silently, especially if you have a large staff. You got to keep that in mind, that they will not tell you. There is still a stigma attached to this. Even though it's not their fault, it's not the person who ingested the pill's fault or the powder's fault, there still is a stigma and people don't like to talk about it. Accidents. Fentanyl and other opioids impair judgment and motor skills, which leads to a higher risk of accidents in the workplace, especially in jobs that involve machinery or that are inherently dangerous. We were at an event in Irvine, and one of the, supervisors of men who work out in the field had 2 overdoses that previous week. It all happened in 1 week. And he took several of our fentanyl survival packs that are on the back table, and so he could have them on the job site. It also has decreased productivity. In the aftermath of accidental overdoses, there will be a ripple effect of morale and productivity in your workforce. Grief and trauma also will happen if you lose someone. You have your business reputation to think about. When a business experiences multiple accidental overdoses, it could face reputational damage and reduce trust from customers and the public. It also can increase your insurance cost. Businesses could soon see a rise in various insurance premiums, such as workers' compensation or liability insurance, if they are deemed to be a higher risk due to accidental overdoses. And then you have legal and liability. In an accidental overdose, if that occurs on your business premises or during business-related activities, the company could face legal repercussions or be held liable, leading to potential settlements and increased legal fees. So what you want to do is make sure you have naloxone in your first aid kits, so you can save someone. You're protected by Good Samaritan laws by using that. No one can sue you. All right. And let's talk about this, increased healthcare costs. Accidental overdoses can lead to emergency medical interventions, which drive up health insurance claims and in turn raise premiums for businesses. Now, this is an estimate, it's very conservative, of fentanyl healthcare costs from May of 2022 to May of 2023. $10 million in Newport Beach will be what has been spent for that particular 12-month period. And that's not including rehab costs. Again, conservative numbers, it's an estimate of over $9 million just for rehabilitation costs in Newport Beach. Okay. Now, we got this number straight from the source. So over the years, Newport Beach Police Department has been using naloxone. I imagine these numbers are going to go up even higher now that they have access to more naloxone, and you can save more lives. But this is July. Look at July. This is only from July. It almost is passing 2018. So I don't know where we are right now, but that's pretty amazing. And then we have the fire department, and they said they respond to about 130 overdoses annually. And that number is probably going to go up as well. Now, the city of Newport Beach just spent over $300,000 on naloxone, right? And then they have an advertising campaign. So you'll probably see more about it, which is good. The more you see, the more you know, the more you can protect people. And naloxone is in every school in Newport Mesa Unified School District. This is a picture from the superintendent, and all the staff and teachers are trained to use naloxone. And naloxone is very simple to use. It's a spray. It's a one-time spray. You don't prime it. You tilt the person's head back. Once they're out, hopefully you will know that they're in a overdose state. They'll have pinpoint pupils. They'll have trouble breathing. You rub them here. If they don't respond, tilt their head back. Spray the spray one time up their nose. Don't prime it. Give them time to wake up while you're calling 911. If they don't wake up on the first one, you get another one. And you do the same thing in the opposite nostril. So that was your fast training. So naloxone there is the generic name for what you probably know as Narcan, right? So in the store, this is what they cost. The Cloxado is a double dose of Narcan. So it's stronger. It also, when you spray it, it will give people withdrawal symptoms when they come out of it. They could be angry, so you step back. You really could be angry. So the withdrawal symptoms are longer, the stronger it is, and the more that's in there. So we have this for you in the back in our survival kits. We have 2 Narcan sprays and fentanyl test strips, and I'll tell you a little bit about those as well. Okay, just before you get there, I'll talk a little bit about the test strips. So this is what the spray looks like, by the way. One time, if you should go like this, it's gone. You have to put it in the nose and then spray it. We also advocate for fentanyl test strips to test medication, especially if you have senior citizens or someone who gets their medication from outside of the United States. We have some medical tourism that goes down to Mexico, and we know that the LA Times did a whole expose on brick and mortar pharmacies being infiltrated by the cartel, and they tested a lot of medications, and they came back positive for fentanyl. So this is how you do it. You test it with these. You just dissolve the whole pill or powder in some water, dip it in, test it. If it comes back positive, why we like these test strips are because, first of all, they're located right here in Orange County, the company, but when you scan the QR code, you can anonymously report the zip code where you got the positive hit. And people who will test their medications aren't necessarily addicts. Addicts don't care about testing their medicine. fentanyl in it, the more the better, right? But maybe a teen that's going to a rave, you want to make sure they come back home and they're going to go do it anyway. They'll think twice, and they'll be like, let me just test this and make sure if it's positive, they won't use it. But they can go onto this QR code. They're usually angry about getting a positive hit anyway, and if they tried to kill me or whatever. They'll put in the zip code, and then now we're starting to get data to see where the problem areas are, right? So that's why we love this particular company. And the CEO is here too, by the way. Can you stand up, Bryce, and just show people so they can talk to you about these if they have any questions? But it can't hurt to use naloxone, and it does not hurt to test your medicine, especially if you're not sure of the origins. Because we say trust the friend, but don't trust the drug. Most of the people who've died from this got a pill from a friend. We are a pill-sharing society, right? If I come to you right now and say, I have a migraine headache, so many people will be trying to give me a Tylenol, Excedrin, or something, or even their prescription medicine for migraines. Here, take this, it'll work, it'll help. That's how we are. These teens were raised with this type of pill-popping society. And now we expect them to go to college, and we're talking about our A students, our star athletes, who care about staying up late studying. A friend will say, hey, take this Adderall, it'll help you to focus. Pill-sharing society. Friends, oh, cool, I can stay up late. Pop, done. One pill can kill. So that's why I'm here talking to you, so you can share this information and you can protect your families. You know how to impact your businesses. I just want to say also, there are ways you can get involved and help support what we do to save people's lives. We have Giving Tuesday coming up for right around Thanksgiving, right before Thanksgiving, where you can give and help our organization to keep going. In the back, we have flyers about business partnerships, which are give back days. Have you ever gone into a restaurant and they said 20% of our profits today are going to go to a nonprofit? We do that. There are flyers on the back table for that. We do lunch and learns, which are completely free, where I go in or Shane will go in and we'll train you on how to use naloxone. And all of your staff, we'll talk about the test strips. You got a brief overview today, but we'll go in depth. For lunch and learns, they could be dinner, lunch, breakfast, we don't care. You just buy a pizza for your staff or something and we'll come in and do that. Volunteer, we always need volunteers, especially for events. Business sponsorships for events and sponsoring our organization. We welcome that. So if you're interested in that, please see me after. And then just basic donations. We always have a QR code somewhere for that. And just know that you are the solution. And if you learned something today, please consider donating at our booth in the back or by scanning that QR code. It's now time for questions, but I want you to be sensitive to the fact that there are people in this room, several people in this room, some you know, some you don't know, who have been directly and indirectly impacted by this illicit fentanyl. They've lost people in their lives, and their lives will never be the same. So with that, I'm going to open the floor up for questions. I saw you first, and I'll go that way. Go left or right, yeah.
All right, I heard that there's another fentanyl which is more resistant to the Narcan. So is that true?
You're talking probably about xylazine, which they call trank, or they call it the zombie drug, because people just kind of like in suspended animation. And they do cut fentanyl with xylazine or trank, and that is to extend the high because fentanyl has such a short life. So when they mix it with that, if you overdose from the xylazine, because it's not an opioid, Narcan will not work. And it's more so on the East Coast, San Francisco, seeing more of it. I'm not sure if Newport Beach has gotten here yet. I think they could tell me probably more about that. But it is something that we have to consider because it's horrendous. And the cartel's idea is to get you addicted. They're not trying to kill you, but they don't care if you die either because you're just a casualty in their money grab, right? So they are not thinking long-term business models, so keep that in mind. All right, and someone here.
Is there an expiration? I noticed on the...
Yeah, they do have expiration dates, but what they have found is that the efficacy is still pretty high after it's expired. Like they found some that were like really old, and then they tested it with high heat and even freezing it, and the efficacy is still pretty high. So when in doubt, that's all you have, use it. It can't hurt anyone. And that's the thing about this. You can use it on all ages. You can even use it on pets. Pets are low to the ground, so if someone was trying to smoke, for instance, fentanyl in a pipe, because they can, heat it up and smoke it, and if that left the aluminum foil down, that's first of all your cue right there. If you see foil on the ground, keep your dog away from it. But say my dog sniffs everything. She sniffed something one time, gave her a bad reaction. I had to rush her to the hospital, and it almost lost her, but it wasn't fentanyl. She'd have been gone. Put it on their gums. If they're too small, you spray it and try to get it on their gums, rub it in. That'll help save your dog. You can use it on babies, infants, anyone. And it won't hurt them if it's something else. So let's say they went down, you're not sure if it's opioid overdose and you're thinking twice. Don't think twice. We say when in doubt, Narcan it out, because it can't hurt them if it's not an opioid overdose. Okay, who else had a question?
It's 3 years though, right?
Yeah, usually. But go ahead.
How do you differentiate between fentanyl overdose as opposed to someone having a stroke or passed out drunk?
Well, usually you have pinpoint pupils and they will have trouble breathing. And if you're not sure, that's why we say use it anyway. That's why we want everyone to have it in their first aid kit and in their car. I'm really hoping we can get some data of how many people are popping what they think is a Xanax in their car and then crashing their car. Because you never know if you're going to be the first responder. We trained an actor who happened to come to our Fight Fentanyl event with George Foreman a couple of weeks ago, right? And he trained on the Narcan. That was October 7th. 2 Sundays ago, he heard a woman crying for help because her brother was literally overdosing. He didn't know them. They were his neighbors across the street. He's going viral now in the paper for it. And he went over. The guy was completely blue. He didn't know what to expect. He used one. It did not bring him back. He just heard some gurgling as the guy was done. Then when he called 911, he's decided after the gurgling, let me try another one, put it in the other nose. No, other nostril. Yeah, it's an alien. And then he thought it wasn't working. But by the time the EMTs got there, he was starting to come to. And they told him if it wasn't for him, that guy would have been gone. He was completely blue, lips, everything. So sometimes we call it the Lazarus effect, because you can see some people actually pop back up and be like, I'm fine. And they were dead. Like pretty much dead, So it's shocking to see. But who else had a question? Somebody else had questions over here? Go ahead.
What is it? What's the agent in it?
That's a good question. I don't even know that answer. It might be on the container in the back. Maybe Shane can pull that out back there for you. But I do not know what it is that makes it work. It's just pretty amazing. Yeah, I'm not that scientific. I'm just like, it works, great, give it to us. Yes.
So you mentioned the one that's stronger than your people can get and have an anger response. My understanding is that's not typical of that.
No, it can be with either. It depends on how much fentanyl they have and how addicted they are. You might, because what happens is they cannot get, if they're addicted, they cannot get high after this for like 8 hours or something like that. So what this does is in your brain, basically, it's the opioid sits on top of your brain and sensors, and basically this knocks it right off. So that way it cannot, the opioids can't sit on top of those sensors. So basically, once it knocks it off, it stays there for a little bit, from 90 minutes on. And so you want to make sure that you get them to the ER, because they can actually relapse again. So we don't want that to happen. So they'll be ready to ride off on their bike or whatever. And you got to be like, no, you need to go to the emergency room. And if you have a teen and they took something and they're just nodding out, that's the time to go to ER. You only use this when they're knocked out on the ground, okay? They passed out. You're worried they're stopping breathing. You can start CPR as well. Anyone else?
Hi, my name's Steve. First, thanks for being here and
Thanks, Steve.
helping us all get out of denial, but still doesn't. Could you talk about how easy it is for kids on Snapchat
Yeah, absolutely. Good question.
to get the drugs? Because I'm not sure everyone's aware, but there's a shortage of Adderall in the country, and they tightened down the access to OxyContin.
Mm-hmm.
So young people particularly, are apt to look for other means So, anyway,
No, that's a great question. I'm glad you brought that up because most people who this has happened to said they never thought it would happen to their family. And usually those are the people that are most vulnerable for this. So there are emoji codes that you can find on the DEA's website that kids know what to look for if they're looking for it, or the drug dealers will have it posted on their profile. So you should know those emoji codes as a parent, and they're right there. Just go to DEA's website. But there are several ways. Either if your child doesn't go looking for it, there are dealers that will stalk children sometimes. We have one in the back that happened to, and wait for the optimum moment to say, oh, you're starting a new school? I have something to help you out, to make you not so nervous and reduce your anxiety. And eventually the kid might be like, no. But eventually if they keep poking enough, they're like, all right, what I gotta do? And they're like, okay, well, I can deliver it to your house, or they can get a service like a DoorDash or Uber Eats to pick it up and drop it off, and they don't know what they're picking up and dropping off. They're just, part of Uber Connects. They pick up from point A, drop it off point B. And you might be thinking they're getting a hamburger or pizza or something, and they're getting pills. And the most dangerous part of that is that when teens use, they usually go up to their room by themselves. You cannot Narcan yourself. You have to have someone there with you. And the parents have no idea, and they find them in the next morning, usually in the same spot or on the floor. Sorry, this is difficult to talk about because I know these parents. And it's too late. Narcan won't work. You have about 8 minutes before you start to have brain damage. So you got to get to them right away, and that's why it's important to have it on you at all times. We had a staff member that saved someone at a car wash that went down. You just never know, and it's so much out there. The parents, all of them said in interviews, unprompted, fentanyl is everywhere. And so not only do they stalk these kids, but they'll go over to Snapchat because it disappears in 24 hours, and they'll do the transaction there. So Snapchat is being sued by a lot of parents right now. And by the time you figure out what's happened to your child, those transactions are gone. So there's that. It's pretty scary, but if you know how to protect your family. Is there any other questions about fentanyl? This is your chance. I know everything about it except what's in it, in Narcan. That's it. All right. Okay, go ahead, Steve.
Are you working on, I think you're working on trying to get some legislation done?
Yeah, we are. Thank you for that. We have a 501c4 called Fentanyl Solution Group, and we're working with a coalition now that I put together of different politicians from Mary Bono. Pat Bates is on there as well, and we did a poll to find out what the voters wanted as far as drug dealers who kill with fentanyl. And the coalition is working to get some legislation passed because as you saw, 18 months, right? You kill somebody's kid, how do they come back for a spanking on the hand for killing someone? In no time in history, our history has anyone just gotten away with murder. So they really seem to mostly go to jail for selling. Our DA here in Orange County has been really great by getting one of his officers deputized federally so that he can take them to federal court where they can get 20 years, but it's not consistent throughout the state. So what we're trying to do is pass a law where if drug dealers do kill someone or more than one person, which they can in one night, that they can will go to prison for at least a minimum of 10 years. So we're working on that. The coalition is, and you got to understand, there's no time in history have we had drug dealers killing exponentially like this. You could go back to the war on drugs; it never happened like this. Like this is unprecedented. So we have to look at this as a different type of monster. Anyone else? Okay. Thank you so much, guys, for listening.
Thank you. Well, very sobering information this morning. And this just capstones what the DA shared with us recently, the sheriff shared with us recently, some of our elected officials. I presume we'll hear from Diane Dixon next month about it as well. So thank you for sharing that. And let me just give a plug to Shane, if I could, because Shane Shane and I worked very closely together at UC Irvine because he was the president of the graduate students while he was on campus. So kudos to you for all the work you're doing as well. So I think, oh, there he is. We're gonna, I know, right? He's like wandering. Hey, closing remarks by Steve.
Switched it up on you a little bit. Yeah, keep you guessing. So yeah, that's our program, but we do have a few other things going on between now and the end of the year. Is it next week? Next week is our luncheon? Well, yeah, for your young professionals, our Navigate group is going to venture into the realm of lawn bowling. We have one of the premier lawn bowling clubs here in Newport Beach. It's up in Corona del Mar, and they've invited us up there. So we're going to be, I won't, unfortunately, I'll be in Paso Robles, but Tyler will be there. I know Tyler's the former head of the group and one of our Navigate Young Professionals of the Year. But if any of you want to try your hand at lawn bowling, join us next week for that. In 2 weeks, on November 15th is our luncheon. It'll be at the Bahia Corinthian Yacht Club. That's our last networking luncheon of the year. No mixer this month. It falls on Thanksgiving Day, and I just can't cook enough turkey for all of you to come over to my house. So our next mixer will be in January. But we will be having one more Wake Up Newport meeting, and that'll be with, as Alberta said, Assemblywoman Diane Dixon will be telling us about her adventures in Sacramento. And it's actually very interesting to hear her talk about the challenges she faces trying to get legislation through, and things like fentanyl, higher penalties for that. And it's just amazing that you can't seem to get some common sense stuff through in Sacramento these days. And then, of course, December 12th is our mayor's reception. We'll be handing out our Ambassador of the Year Award, our Silver Anchor Awards, our Navigate Young Professional of the Year Award, as well as welcoming the newly appointed mayor. In Newport Beach, in case you don't know, we have 7 council members. And each year on the last council meeting of the year, they select one of the 7 to be the mayor for the next year. So we do it a little differently than a lot of cities do. And so it's always interesting to see who that'll be. And so you're welcome to come and join us. That'll be at the Back Bay Bistro. And then, of course, our biggest event of the year, the Christmas Boat Parade, December 12th or 13th to the 17th in Newport Harbor. I think we're going to have some exciting new additions this year to that event. So please join us for one or more nights out of the 14-mile path around the harbor. And I think that gets us to the end. Is there anything else I'm missing, Annette? Oh, Jingle Mingle, December 6th. Yeah, that's going to be, where are we having that at? At Guacamigos on Coast Highway. So I think we were there last year for Jingle Mingle, and it was a lot of fun. So you can see the lights out on the water and some boats passing by and have some great Mexican food. So any questions about things going on at the chamber? All right, if you're not a member, you should be. And please grab some donuts, bagels. I think there's even some lox back there. And some of the, what do you call them, the kits?
Fentanyl survival kits.
Yeah, fentanyl survival kits. So grab a red bag on your way out, and maybe you'll save a life. Thank you.